Hey, it's Dr. Goodman, the orthodontist. Happy 2024. I hope this video and email finds you well. I'm sending this out to parents of patients who completed orthodontic treatment in recent months and years. And the genesis of this video was an interaction that I had with a college student who was a former patient of mine. And it was really a key moment that I want to share with you as it pertains to your child and their orthodontic retainer wear. So this is a patient that has been wearing his retainer over the past 10 years since I treated him. He would always come back every 2-3 years. I've seen him maybe 2-3 times over that span. And mom always would buy him retainers. I think she would even buy a couple of retainers. And he recently came back from college and he walked down the hallway. His teeth looked amazing. He sat in the chair. And as we were about to scan him, he said, "Hey, do I really need this retainer? Because I got to be honest with you, don't tell my mom, but I haven't worn it in like the past 6 months and my teeth still look fine." And his teeth did look fine. So we scanned him anyway. And his teeth were not as aligned as they were at the end of treatment. And so that question is really the catalyst for sort of the eureka moment that I had. I'm well aware that retainers oftentimes can eventually not be worn. But here I was catching this guy at this critical moment. Now, the critical thought that he was having, if he were to go without wearing that retainer, his teeth will certainly gradually get worse. And I have 50% of our practice is adults who stop wearing their retainers. So we explained to him that, hey, you need to have a new retainer that fits well, because when we asked further, what happened was he kind of stopped wearing it and then it didn't really fit because that small movement made the stiff form-fitting plastic not really adapt to his teeth and it was uncomfortable. So as this pertains to your child, it's possible that your child is not wearing a retainer as much as you think. And I know that there are only so many things that you can pester your teenager about. A lot of demands on our kids these days, and I don't know where orthodontic tooth alignment lines up and is as a priority. But I empower you to go and ask them whether they are wearing their retainer. And not just that, I should be more specific. Ask them to bring the retainer over and pop it on their teeth. Now, I know how teenagers can get, but just say, "Dr. Goodman contacted us." It's easier than coming into the office. And watch how it fits. It should snap on the upper teeth, snap down on the lower. It should not be hanging. It should blend in seamlessly. If it doesn't, or if they don't produce the retainer, then I highly suggest that you have them come in so we can evaluate it. If their teeth have regressed slightly, we can make a new retainer. There'd be a charge for it. But this is better than things getting worse and worse and worse. So if you have any questions, feel free to contact me or the office, and have a wonderful 2024.